So this is a great question. Why an iron panel was not done on a ferritin level when your doctor is working you up for fatigue? Um, and that sort of goes back to what we used to do before. I mean, obviously, we know more information now that the iron panel, ferritin, transferrin has become part of the workup of fatigue. But before, when you're working at fatigue, that was not usually what came up. If they check a CBC and your iron, your hemoglobin and hematocrit are normal, then it was considered to be in the normal range. But here's the thing: a lot of clinicians, we are trained to start with a CBC, and if the hemoglobin is normal, then some clinicians may stop there. But what we know now from the evidence is that you can have iron deficiency without anemia, right? Without the hemoglobin or hematocrit being abnormal. And patients will still feel very symptomatic without the anemia. So your hemoglobin can look completely normal, but your iron stores, your ferritin, are actually low. And that matters because iron isn't just about anemia. Right? For patients who have iron deficiency, it's very critical for energy production at the cellular level. You also need it for oxygen delivery to tissues, brain function, including focus and mood. So when your iron storage is low and you complain of fatigue, your mood is down, your cognitive issues, it's important that we're not missing that. Even before you get that red flag of a low hemoglobin and a low hematocrit. Now, ferritin is one of the best tests we have to access iron stores. Where, a low ferritin is very suspicious that you have iron deficiency, right? But there's an important nuance here, too, in that a low ferritin itself is also an acute phase reactant. So if you have increased inflammation, infection, chronic diseases, autoimmune diseases, sometimes a ferritin that looks normal is actually a masking low iron. And that's really more prominent in patients with inflammation, a higher BMI, autoimmune conditions, or chronic illness. That's where clinical context is very, very important when we're checking blood work, and that really across all situations. We need a ferritin level that's great, but in some cases, you need a transferrin saturation. You may need a full iron panel, and even a CRP if you're really trying to interpret what's really going on when you're checking somebody's ferritin level. So for me in my practice, if someone has fatigue, especially ongoing fatigue, I have a low threshold to check iron studies, which is an iron panel with a ferritin, including a transferrin, particularly if you have history where, you're having heavy periods, perimenopause, postpartum changes, hair shedding or hair loss, restless legs, a low iron diet, or just unexplained fatigue despite normal labs. So that's my take on the importance of adding a ferritin panel now, an iron panel with a ferritin to your blood work, because a normal CBC does not rule out iron deficiency. A normal CBC may rule out anemia, but it hasn't really addressed iron levels or iron storage.